Well, according to recent stats, at least 25 million people suffer from sleep apnea. And everyone knows that when you don't get good sleep, other areas of your life tend to suffer. Dr. Blaise O'Brien with Ohio ENT and Allergy Physicians is here to explain what it is, how to spot it, and most importantly, how to treat it. So thanks for being here.
Thanks for having me.
All right, let's start with the basics. Somebody out there says, maybe I've heard sleep apnea before, the word, but I don't know exactly what it is. So tell us what it is.
So sleep apnea is a condition where you stop breathing at night because your airway gets obstructed and your oxygen level drops, and you have to wake up constantly at night in order to breathe. And that can lead to problems such as sleepiness during the day, heart problems, lung problems. It can be a bad issue.
Do we know why so many people have it?
Well, certainly as we get bigger as a society, that can contribute to sleep apnea. Some people just have it because of their airway anatomy. Other people, it's just they've gotten heavier over time and start obstructing at night.
So let's see or talk about what somebody would notice, would see. What are some of the telltale signs that they may be having sleep apnea?
Well, one of the most common things that we see is that the bed partner notes that the patient or the person is snoring really loud and stopping breathing at night. So that's the typical sign that we'll see. But then also people will feel very tired during the day, fall asleep inadvertently during the day, don't feel like they're as sharp or as engaged as they would like to be.
So don't tell your husband he's crazy when he's saying you're snoring. Actually heed the warning that he's giving you.
Absolutely.
So how is somebody officially diagnosed then?
So the way we diagnose sleep apnea is with a sleep study where they measure your oxygen level at night and watch your breathing and see if you're stopping breathing and obstructing at night.
Treatments, what can be done? It's good to know there are things that can be done.
The most important thing, the first thing that oftentimes we'll tell people is to exercise more, lose weight. That's oftentimes a very effective treatment for sleep apnea. But the gold standard is really something called CPAP or BiPAP, which stands for continuous positive airway pressure. It's a mask you wear at night that stents your airway open so that it doesn't collapse at night and you can breathe better. Now, about half of people that try CPAP love it,
Sure,
but half hate it. So it's very effective for a lot of people, but some people just can't tolerate it.
some people just don't want to go to bed at night with it on their face. They have, they just can't sleep well. It gets in their mind probably more.
A lot of times people have claustrophobia. They can't tolerate it very well.
So for those folks out there who that hasn't worked, who have tried everything they believe that's on the market, the good news is you say there are new things coming out.
There are new things. Sometimes we can do surgery for people if they have large tonsils, thick uvula, which is the little thing that hangs in the back of your throat, or if their nose is obstructed, sometimes we can open those things up and that helps. There is a new treatment just approved last year. It's a stimulator for one of your nerves that goes to your tongue. It's like a pacemaker that we put in your chest here.
Yeah.
A little electrode goes to this little nerve. And so when you're sleeping at night, when you're breathing in, instead of your tongue flopping in the back of your throat, your tongue just gets a little stimulation and it protrudes your tongue just a little bit so it doesn't collapse. And that way you're not obstructing at night.
That's interesting. So it's probably so light too that you don't really even notice it. People might think that sounds like I'm getting electrocuted, while I'm sleeping, but it's not.
It's not a shock. It's just a little bit of a sense of motion that you get in your tongue. So it's not uncomfortable for people.
What happens if you have sleep apnea and you don't treat it?
It can lead to serious health problems. Definitely a higher risk of heart attack, strokes, lung failure. So it's especially if it's severe, if it's not treated, it can be very serious.
All right, Ohio ENT and Allergy Physicians, you guys can set up the sleep study, do everything somebody needs to find out if this really is their problem, right?
Absolutely.
All right, Dr. Blaise, I want to thank you for being with me today.
Well, thank you very much.